Hi guys, so today I will be talking about dental care for patients with heart disease. So we all know that our oral health is vital for overall health. Cardiovascular disease is the most common systemic disease in the United States. We must educate our patients that periodontitis is a risk factor bacteria in our mouth traveling into the bloodstream and infecting other organs. So I thought this picture was pretty neat because it shows an infected mouth and then the bacteria in it traveling through the bloodstream into various organs, including the heart. There are many types of heart diseases, but here are a few we should be aware of, such as infective endocarditis, heart attack, heart rhythm disorders, ischemic heart disease, such as hypertension or high blood pressure. ACVD is what we just learned about. So that includes angina, myocardial infarction, stroke, transient ischemic attack, peripheral artery disease. So, us as hygienists, we must be proactive by taking blood pressure readings at every new patient visit, recare visits, or annually for current patients to rule out any underlying disease. This can prevent a medical emergency such as a stroke or a myocardial infarction in your chair, especially with patients unaware of their severely elevated blood pressure. So remember that hypertension is a silent killer. What we can do for well-controlled hypertension is prevent the blood pressure from spiking in our chair. So pain management is important to prevent the blood pressure from spiking. We can do stress management protocols, especially for the anxious or fearful patients. Some offices do recommend sedation or nitrous oxide. So if your office offers that, that would be a good offer for that patient. So some patients may have implant devices such as a pacemaker or an implant defibrillator, and this is kind of what it looks like with a chest X-ray. So what it does, it just helps the heart maintain a proper rhythm. So the tools that we use, such as the ultrasonic scalers, can interfere with these cardiac devices and could result in an irregular heartbeat. So it is best to be avoided for some patients. Physician consult may be needed. Antibiotic prophylaxis. So that is when a patient is required to take a pre-med before any dental treatment. So these patients include artificial heart valve replacements, patients that may have infective endocarditis or are at risk for it, patients that have a heart transplant with one or more valves inside the heart, some patients that have a congenital heart disease may also need one. And then if they had a defect repaired with a prosthetic material or device during the first 6 months after repair, then it's required to take it just to prevent any infection from occurring. Also, if they have had a heart defect repaired and there's still a residual defect remaining, then it'd be smart to take a antibiotic before any dental treatment. So usually it is prescribed to take 30 minutes before the procedure. Either the dentist or the physician will prescribe it. If they forget, some dental offices keep antibiotics for these cases. It is important for us to document also if they have taken it, what time they took it, if they know. And then if we administer one as well, like we have to note it on their chart just to make sure if they do get an infection, they don't come back to us and tell us that we didn't give them anything when we did. So Not all patients with heart conditions may need it. Dentists will determine whether it is needed or not. So they may need to talk to their cardiologist for further instructions. And then here's a YouTube link that I will copy and paste to where I submit this so you guys can look at it because it's pretty neat. Oral findings. So some patients may have xerostomia, and it's common due to various medications that they may be taking. Some patients may experience gingival enlargement, and that may occur on patients with hypertension taking nifedipine. Increased bleeding if patient is on a blood thinner medication such as warfarin. So I read that it's kind of controversial, I guess. There's some patients that or some dentists that would like the patient to stop taking the blood thinner before any dental treatment, so such as like extractions and all that. But for us, as just cleaning, usually there's no need to have them stop. But if there is, then that's usually on a case where a patient is not taking the medication as prescribed. So let's say they're taking it maybe once a week or whatnot. So that's that. And then oral recommendations are that we should recommend them brushing and flossing twice a day. Before recommending a water flosser or power toothbrush to a patient who is at risk for infective endocarditis or with a pacemaker, it is important to consult with a physician in order to assess patient's overall risk of bacteremia or interference to the pacemaker. We should also encourage them to visit dentists regularly for professional cleanings, which is every 6 months. And here are my citations.